Welcome to Hope Ahead, a journey of infertility. My name is Naomi Ripstein.
And this is Ryan Ripstein.
And this is our story and struggle of trying to conceive.
We hope and pray that by sharing our experiences and trials, we will bring glory to God, awareness to infertility, and also be encouraging to others.
And just a reminder, this is our story and personal experiences. We are not offering medical advice.
Well, we hope you enjoy the discussion, and thanks for listening.
Hey guys, welcome back to episode 7 of Hope Ahead. This episode is titled, All the Things We Have Tried. And hopefully we'll be good enough. We may leave some stuff out if I forget, but we tried to type it up nicely for you so we remembered.
There's a lot of things.
There's a lot of things.
Yeah.
So we hope you guys are doing well. We're just going to start off real quick with a opening word of prayer just to set the mood and hopefully to help us remember all the things that we want to share with you guys. So, dear Heavenly Father, thank you for today and thank you for my husband and for our listeners. And I pray that you would just bless this episode and let us recall what we need to recall and share what we need to. And I just pray still for our listeners and just what they're dealing with in the day-to-day life. And I pray that you would continue to help us in whatever situations we're going through. In Jesus' name, amen.
Amen.
So we'll start off kind of in the sense this was more or less to talk about when we started doing big lifestyle switches, right? Biggest thing might be after my leap was we were talked about in the last episode with 2022.
Yeah.
We might have done some of this stuff previously, I feel like.
This is all kind of mixed in, but
yeah.
the extra things I think we tried in addition to like going to the doctor and like the doctor stuff.
Yeah.
Everything we added in kind of separately, and
I feel like
some
this is a
sporadically,
little
some
more
morbid,
vamped up though, this 21, 22 kind of year.
Yes.
You know, where we were like, okay, let's do all
We're
the
gonna
things.
do the things.
Okay.
Yeah.
Start off first with acupuncture. I had a friend that recommended this, that she had started doing, and she really thought the results were good. And I had heard of this somewhat before. We did a juice cleanse, which I think we've referenced before, and this was kind of hilarious.
That was probably the biggest fail of everything for a number of reasons we'll
clean
talk about.
Eating, doing something called a gut protocol, which you guys might be familiar with. Herbs and supplements, which we have lined out for you here, but you guys can't see because we technically can't show the brands and all this stuff because we're not giving like the medical advice, but we're going to tell you all the stuff that we have tried.
We tried, some we take,
out,
some we stopped, some we still take.
And also I want to talk about with castor oil packs. I think I've mentioned those before, where we use castor oil and you apply it onto your skin. Most of the time it's like your abdominal area, but you can do your thyroid heating pad or hot water bottle applied. Essentially just helps with circulation, filtering, detoxing, help with muscle pain, help with GI issues, all the things. It's a great thing. And then fertility massages. That was something that I got kind of introduced to just do around like your ovaries and your uterus and like feeling for those points. That might have been still more introduced with like a naturopath, Chinese medicine kind of introductory thing. But, so we're going to start off first with some of these supplements. So I'm going to slide my computer to the side that has my little cheat stuff on it. But, so we'll start off first, since we're going to go into acupuncture, the Chinese medicine ones. I have here the one that helped me cleanse my uterus, so like clean it out good, and then the one that helped with circulation. So there's 2 pills there. Then at one point there was collagen. I still take a collagen protein powder mix from the Needed company. Then I have my prenatal multi from the Needed company. We have multiple brands of fish oil because I went back and forth on which was the better one and the higher strength. Yeah,
the big difference there, I think, is whether or not when you burp, you taste fish.
This one has, this newest one I got is great. It's the lemony thing in there for fish burp. It's wonderful. Probiotics and prebiotics, so things that we knew to help with our gut health. There was, let's see, I have iron here, which was the supposedly a better form of iron in the sense of the ferrous bisglycinate, which is supposedly the better one for you to process and everything. But I only stayed on that for a little bit because I think it made like hemorrhoids show up. Folic acid, before we knew that you can have problems converting and you need to get technically methylfolate and not just folic acid. The B complex that has folic acid and B6, B12, niacin, all the things to help with that. So we have moved on even from that because that's now in our daily.
Yes.
Have the Vitex, which is something to help with hormones. That I really do feel like that helped me. I haven't been on this in a while, but that helped regulate hormones. It's supposed to also help with your prolactin, and that's the reason I got it. If you guys have followed with the previous episode, I was slightly elevated, but not a concerning level. But I had looked up if you do like a certain dose, which I think I did here was 500 milligrams, that can help lower your prolactin levels, along with other estrogen, progesterone, like leveling out. I got beetroot here. It's supposed to help for circulation and like blood pressure, cholesterol, all those things. I got my magnesium, which I still love. Totally, I am a magnesium girl. I tell everybody about magnesium, for all your things. I have magnesium citrate and I have magnesium glycinate. Just depends on kind of the absorption that you need.
I mean, mainly that's what, like muscle health?
Muscle, blood vessels, joints.
Okay.
And like, more in the muscles for like softening things for your bowels, different things like that. So, but I mean, even nerve issues, it helps with like the nerve stimulation and everything like that.
Okay.
So, I got my extra supplements here of vitamin D, which I think that made your stomach upset when I had it.
Is that the little small one?
The little cute capsule?
Yes, it's a great looking little capsule. It's very enticing.
He obviously
to take,
didn't need it,
but
it
was upsetting to my stomach.
Yeah. I got the alpha lipoic acid, which is normally what you take to also help with like blood sugar. Girls that deal with PCOS normally take this. And I think I just was taking originally because it's a free radical scavenger. So in like all the things that are antioxidants and like clear out all the bad stuff, in my mind, I was thinking anything that would cause a malformation of an egg or a sperm.
Yeah.
I was like, so let's do all those. And then glutathione is along the same thing. It's another free radical neutralizer that helps like your liver process and break things down. So I was kind of taking that to kind of like ramp up my liver if it needed to filter out bad stuff. I got milk thistle here. I was taking that mostly because, and there are proven studies for this, that it helps with liver cancer. So obviously I don't have liver cancer, but if you knew from the previous episode, I was being monitored for high level precancerous cells.
Yeah. Okay.
Yeah, precancerous cells on my cervix. And so I was taking this to really just fight, combat, do whatever I could. Vitamin C is always a good one.
Vitamin C for just immunity in general.
Yeah. And those are like, zinc. These are all things that we have tried in the past in summer that we're still taking. So don't just think that we're taking like 30 supplements.
No, yeah.
It probably felt like that at one point, but these are just all the things that we have left over in our cabinet.
Yeah.
I have a turmeric and ginger, which is also really good for circulation, brain health, joint health, GI health. Extra vitamin E. We got Ryan's male fertility support that we're currently doing from the Pink Stork. It's actually called Blue Stork for the guys. And then CoQ10. I've talked about those in previous episodes. And then we have one here Ryan took during the time we did the acupuncture called the Sea Dog pills. Essentially, mostly just helpful for like semen.
I have no idea what the ingredients
formation.
are. It's all Chinese.
Literally.
Yeah, literally written in Chinese.
And he just took that for, like I said, for 30 days. So a lot of these, we did try majority of these. I just mentioned that one.
Oh, okay.
The CoQ10. We did try the majority of these at least 2 to 4 weeks to see if we noticed a difference. That's really the best way to see if a supplement is working for you, unless you notice like upset stomach or something else initially. But so some of these I really was trying to give them their fair shake at seeing if they did anything. Some of them worked, some of them didn't. Some of them might have worked, and I just didn't know because we didn't have the blood test to show that, but I didn't feel any different.
Yeah.
So, but yeah, yay all the supplements.
That might even be just most of the supplements. There may be some that
there's some that
stopped
we
and
have
don't
finished
have anymore.
and we don't have anymore.
Yeah.
Yes.
So there might be other ones in there. But yeah, just there was a lot of stuff. Like you said, at one point, there probably were 30 or 10 pills at a time that we were taking or something.
I think I was probably taking 18 to 20 at one point, and I was like, this is disgusting.
Yeah. And you struggle to take them like multiple at a time. Yeah. So you're like one drink, like one sip.
1 to 3 at a time. Ryan just throws
a handful and
He's very impressive. Yes.
Work it out.
So we'll go back to the acupuncture. A friend that had recommended this said that, it was really helping her feel better and everything. So I went in under the same lady that my friend was seeing. And if you're not familiar with acupuncture, I'll just give you a quick rundown. So as a physical therapist, we do dry needling. That's what we're able to be certified under. So that follows the Chinese mapping of like what they use for acupuncture, but we do it more in a muscular skeletal kind of way, whereas acupuncture is using it more in like a healing form with like circulation, nerves, muscle, chronic pain, different things. So they do it in a little bit more of a holistic way, whereas as physical therapy, it's not that we're not trying to help with pain and everything like that, but we do it in a little more corrective way, I guess.
Yeah. And it almost felt like, to me, not being medical, that it was, like you said, very similar, doing the same things, but understood conceptually in different ways.
Yes,
right?
Different
terminologies, what they call
and like
stuff,
I said,
what they
holistic.
name stuff.
So they were looking at it as a whole for your body, not just trying to fix the one thing like the back pain.
Right.
Like they're like, well, are you having headaches? We're going to fix that for, so that.
Yeah.
So they use a meridian map that focuses on sensory nerves, blood flow, and muscle pain that could be acute, so like a recent injury, or chronic that has been going on over a long time. The acupuncturist that we use was experienced in fertility. So not all acupuncturists are the same. Mm-hmm. They're not all trained in fertility.
Just like Western medicine.
Yep.
Not all
different
trained
specialties and everything. Yep. I had introduced Ryan to a podcast to talk about acupuncture, to kind of like get him on the same board. Cause like I said, I'm doing all this stuff, and poor guy is like, what's the next thing we're going to do?
Mm-hmm.
So I had
kind of like we've talked about before of, is it time or is it not time to like try the thing? And, he's like, well, let's try this thing next, So.
And these are all good things. And I don't want to dismiss any of the stuff that we have tried. Just because it hasn't worked for us doesn't mean that it hasn't worked for a ton of other people.
Yeah. Well, because the reason you wanted to try it in the first place is because it
has worked for other people. Yeah, exactly.
So that's the whole reason. So we're not saying that it's
definitely give it a go if you're comfortable with it, or do your own research too. They do list with the acupuncture that like it could be like a 50-50 chance of it being male problems versus female. So that's why they really do encourage men and women to go together as a couple when they're trying to conceive. But us being women, we have more body parts and things that could go wrong other than the guy, you know. So we went to go see this same acupuncturist, and she didn't try to shove her ideals on me or anything. I was pretty well versed in what, was going to be happening. So they do use references such as like hot and cold to talk about your circulation, like whether you have too much circulation or whether you don't have enough circulation is like the cold. So kind of getting used to those terms and what they're talking about. And even with, I guess, even the digestion, they talk about it in a different sense. So she would reference, like with my friend, she told her she had a cold uterus, which essentially just means your uterus is not getting enough circulation. There's a blockage or something else going on. They also did advertise stuff for like, for cupping. So that's the thing where like they put the glass bulbs on the back of you. You might have known that from athletes that have done that, essentially causing a lot of blood flow to come to a certain area, kind of like a bruising in a sense, because it's bringing all the good stuff to the area to help with like healing. And also then when you release the bulb, they only leave it on there for about 10 minutes. It allows all the bad stuff then to kind of seep out, like gets the toxins
from the surface.
out. Right. So, real cool. I mean, I always liked it when she did it.
It's like good hickeys.
Yeah. On your back.
On your back.
Because that's really where she would do it. It's just mostly your back.
I don't know what made me think of that.
Okay.
Random.
So she did do the thing though too, which we've mentioned to you before. I told her all my stuff and, and, she took off of me like positive energy or whatever, but she's like, oh, you'll be easy to get pregnant. And I'm like, okay, here's another person.
Yeah. Heard that before.
Yep.
Yeah.
Which
like
I appreciate their enthusiasm, but I've just become more of a negative Nancy.
It's the thing we've talked about, right? It's the anticipation, it's the optimism, which is great until it doesn't quite work out, and it's
you want someone to be optimistic for you.
Well, it's better than don't think this is gonna work.
Yeah.
Why would they ever say that, right?
Yeah, exactly.
This probably isn't gonna work, but let's try it anyway.
Yeah.
So.
But this is where she gave me the things I had mentioned previously. She gave me a uterine cleanse that I needed to do for 1 month. And then we also did like something to help my circulation. Mm-hmm. And after the 1 month, then she wanted to move me on to this program that they have. It's a 3-step program for a 1 month cycle. And it's essentially drinking a tea, but their tea is in a little package and you mix it in a certain amount of water. Still looks brown because of all the herbs and stuff, but it does dissolve a lot better and you don't have to like brew it or steep it or anything. It still doesn't taste the best, but this one was at least more tolerable for me than this other current one that I am on, even though this current one that I'm on is way better. Like definitely seeing results from that. Mm-hmm. But it was like about this program that she put me on was $150 for 1 month. And I did have a friend that tried to do this and she couldn't tolerate the taste. So I don't know what it is with all these herbs. They can help you, but you got to be able to stomach them and get them down. Yeah. Which is why I'm like, pills. Can I have a pill?
Yeah.
So we did the 3-step program with the acupuncturist, and then she moved into doing electrical stimulation. So another thing with acupuncture you're probably aware of is they use the needles, right? That they embed down into you based on the meridian map. They find it like certain points or whatever, and they place it. And sometimes they're more tender. Sometimes you don't feel anything. Normally, if they're tender, they say that's where you have like a blockage, that the signals aren't going as smoothly and your circulation's not as well. So kind of when they put the needle there, that is stimulating that area to kind of heal and bring good stuff to it. So we did the stimulation thing. We were going once a week starting in June. Mm-hmm. Started going once a week. And she was fine with that plan. I know some other people that go twice a week just to get things going. But since I was already good, right? Yeah. She said, let's do that. And Ryan was coming, and most of the time we went together at the same time.
I think, when I went, you were there. Every time I went, you went.
Okay.
There were times when you went that I didn't go. Maybe 2 or 3 or something.
Okay. Yeah, I think just with different work things that were going on. So we liked our acupuncturist. The receptionist that we had, nice lady, but we really weren't a fan. She was very pushy. And that made us
salesy.
Very salesy. And, that kind of gave us a little bit of a bad taste in our mouth. And maybe you guys can relate if you've been to the office like that, like an acupuncturist or another person. Like the medical staff really can make or break it for you. The doctor could be great, but if you have bad medical staff, your patients aren't really going to want to.
That's similar to what we talked about with the IVF place, right? Of just the doctor was great, but the staff was like, meh.
Yeah. And those are the first people you see, so you definitely want them
and the ones you deal with the most
and do your payments through. You're right.
Yeah. You only interact with the doctor for 10 minutes, 15 minutes. On a long day, right? But the rest of it is interaction with the staff.
Yeah. So. We just got a little bit more judgment from this receptionist. Like if we decided to do something differently or not right then, if we didn't want to pay for it, she's like, well, you really should. All this stuff. Well, you're not going to get the best benefit. And it's like, doing the best that we can. Appreciate you telling us, but don't give us that judgmental tone. But anyway, the only thing I would say that was kind of like triggering in a negative sense with the acupuncturist is that every time I came in, she would ask if I was pregnant. And I'd be like, nope, not yet.
Yeah.
And she'd be like, oh, well, this patient I just dealt with, she came in for back pain and we started treating her. After 2 months, now she's pregnant. And that's not even what she was coming in for. So she was very confident in her skills, maybe a little like, not, I wouldn't say cocky, but she was very confident in the sense that like she was going to be the one to get it for us. And I appreciated it. But at the same time, it also just kind of rubs salt in the wound whenever I come back and she's like, oh, not yet. Oh, well, let's try this. So let's do this. And I'm like, I'm doing everything that you're asking me to that I can.
Seems like that is like a completely unrelated thing. Came in for back pain and
that's just, like I remember that's one of the stories she told me.
Yeah, but it's like, it's just a weird connection, like unrelated thing to the story.
It could be still circulation and everything. I think it was more or less just that they came in for acupuncture, and acupuncture can help in many other ways. Sure. Okay. I think that's kind of what she was implying. Okay. Yeah. So I kind of felt like a failure whenever I'd come in and tell her, nope, not yet. And she was just another person that I felt like I was letting down. So that was another bummer kind of a thing. Cause like I said, didn't want to have to deal with any of this anyway. And I'm coming in to get help. But then there's one more person that's checking in and I have to be like, not yet.
Yeah.
You know,
I mean, like last episode we were talking about just left behind, right? Just yet another way of not us.
Yeah.
You know?
Yeah. So we'll move on to the juice cleanse if you want to talk on to that. So we use this company called Squeezed, and great, you know, their juices were fine, but we thought we were being all smart and doing a 7-day cleanse. And
it's maximum effect is what we were going for. It's like we can do it. If 2 days is good,
we're
7
awesome.
days
we
is
can
the
handle
best.
This.
We can do it. You know, that's when we were thinking clearly with carbs in our brains.
Yeah.
Once we went to juice after a couple of days, we're like, what's going on? What day is it? How much longer is this? You know,
don't get angry at me just because my blood sugar is low.
Yeah, it's like, it's not my fault. Like,
and really, the juices provided, I mean, other than there was like a milk one that had the most calories and most sugar and stuff.
It was like an almond.
Cashew milk?
Cashew milk. That's it. No, yeah.
And other than that, the other juices, they had about like 130 to 150 calories in them. So you were still getting calories.
Yeah. I mean,
and you were supposed to drink like six
or seven a day. Yeah.
So your max calories, I think, were probably like about 1,200, 1,300. So it was still a lot.
Yeah.
But who wants to keep just drinking juices when your neighbor is eating a burger?
Yeah. I think we didn't account for, I think, the mental strain of what we were not having.
Yeah.
Right?
Yeah.
And it seems like it was going to be easy to drink the juice, which it was. I mean, it's easy. It's all there for you. But what your brain keeps saying is like, this is what you're not having instead. And I like this better. And this is more delicious and blah, blah, blah. And
we were doing this to be healthy and maybe lose a little weight, but it was mostly geared on the sense of fertility. Like we were like, if we can kind of clean everything out that has been toxic to us and start over, then that's what we would want to do. So that was the thought process behind this. We're not just doing it just to see if we could do it.
And I mean, what really ended up happening is, I think after, was it the third day?
3 days.
Where we were like, well, let's have something else also.
Yeah.
Right?
I think we were allowed to have raw vegetables.
And then the something else also turned into like, let's just stop.
Let's have a sandwich.
Let's stop doing the juices.
So maybe you guys, some of you have tried this and succeeded, and kudos to you.
Yeah.
We were not successful.
We didn't do it. We didn't make it.
But, I mean, I wouldn't say that we would never do it again, but we probably, and even on the site, I think it recommended only doing like 1 or 2 days to start.
If you're new.
But we were very overly confident.
Yeah.
And then we wasted a lot of money because we threw so much away.
Oh, man, we threw a lot. Yeah. We dumped out bottles and bottles. Yeah.
Mm-hmm. And then we go into really start evaluating our household items. So this now leads into like September time.
Storage stuff.
So we had some glassware already, but you guys probably know if you've been on this journey a while, where they recommend you can store stuff in plastic, but obviously not heat it up. And, just to be aware of even putting hot foods in the plastic later after you've cooked them and stuff. So we did really vamp up more of our glassware to kind of have that for like meal prepping and everything like that. And then Caraway we started replacing
like
our
a ceramic cookware.
So, cause like other than that, they recommend the cast iron, that's something from that you shouldn't get toxins and stuff from, but all of the other stuff that could be scratched or whatever.
Yeah. Stainless steel is also good.
Stainless steel's still okay. Yeah.
But like Teflon coating and different things like that.
All the extra things that you can get leached into your food when you're
generally
cooking.
Not recommended.
And
anymore.
this stuff was pretty expensive, but it's been very durable. I mean, we've had it now for almost a year. And so we really did, but we had a lot of stuff we could throw out, like things that were older that we could replace. We replaced the bakeware and everything.
The one downside for me is that it's recommended to not wash it in the dishwasher.
Gotta hand wash it.
And that's kind of a bummer.
Well, that's kind of like with the cast iron though too.
Let us know if y'all have any ceramic hot cookware and still wash it in the dishwasher anyway. Cause that could give me some ammunition to get Naomi to let me wash it in the dishwasher. Yeah. Not hand wash it, so which I really don't like doing.
You can wash this in the dishwasher. It just will not last as long.
Right.
So that's the thing. It's like you're spending all this money for this expensive cookware, so you want it to last, right?
I just want to get out of doing work. So if anybody can help me with that, that would be great.
Don't encourage them. So we go into now, we had looked into, so like we were talking about like all the things to help our gut and like look to see if we have any food allergies. Cause a lot of the times that could be hindering your fertility if your gut is so important. And we've been learning this more and more over this journey, that and your liver, just all the stuff it filters and what it absorbs. And so we found something called the gut protocol, and they recommend doing this diet at least for a month. It's like a food elimination diet. And then you reintroduce things. So you guys might be familiar with this with like the FODMAP, where they have you like eliminate a lot of things that could be irritants, and then you slowly add things back in to see what bothers you. We've kind of done that maybe a little bit before. Yeah. But not.
But on this one, we kind of just.
Well, and we did it like together. You were saying. Too. Yeah. So. This was like the main things we were optimistic. They did tell you like, so, I mean, you hear all these success stories, right? Like once again, all these things that we've tried were based off of people's success stories and how it worked for them. And so they say, if you're doing these things and things calm down after that 60 to 90 day cycle of your eggs and your sperm, that could help rejuvenate them. So I was thinking, well, we're doing this from September to October. So that meant like our December, things that had been developing should be pretty good. Like maybe that's going to be our month. So the top 6 foods that they have you eliminate: gluten, dairy, corn, soy, sugar, and alcohol. And they do allow a little bit of like, I guess some natural sugar in there, some like maple syrup and honey, but that's
no monitored. Sugar,
right.
No
right.
Sugar substitutes, different things like that.
And you sign up for the program. You can do an exercise component as well. We just decided to do just the food because we were already exercising on our own. We have a little room dedicated to a gym that we were doing stuff in. Yeah. So we got just the stuff for the food, and they give you recipes and you have videos to watch to kind of encourage you, and then you get printouts. So if those of you have ever done 21 Day Fix, it's Autumn Calabrese that does the gut protocol and is maybe the founder of that. Like she's the face of Beachbody. So like they're all kind of affiliated in together. But she's not the founder of Beachbody. But the Adelaide White was someone I'd mentioned before, and I'll post her again. She was the one that I saw on Instagram really pushing for this gut protocol for fertility. And so that's when I was like, let's do this. And I mean, good results from all the things. I mean, it's never wrong to get a little bit more healthy.
That's right.
Right?
That's right. And I think that's the maybe high level summary of most of what all this is that we've done, like you've talked about. It is, anecdotally, it's helped these other people get pregnant, and that's why. But obviously it wasn't it was helping the issue that was preventing that couple, right? So depending on what the situation is, these things help, but maybe that thing that it fixes or helps or improves isn't the thing that is preventing
Right.
us.
Like it
And it
definitely
may not
didn't
be the
hurt
thing
us
that's
or
preventing
anything.
you, right? So kind of what we're talking about, it's like these things are great to try, but I guess what we've learned is like to temper our expectations or
Yes.
to, different things like that.
But
Like,
also
let's
to
not
give
get
you
carried
experience
away.
of things that we have tried and we've enjoyed. So then if you're looking for something to kind of help you out, you look into the gut protocol.
Mm-hmm.
It's kind of similar, I guess, to some of the Mediterranean diet. I mean, there's also the keto diet that's out there. We've never tried the keto, but I know a couple of my friends that have done the keto diet, and it really helped revamp them, and they got pregnant. So these are different things. Those are just ones we haven't tried. So the ones that we have tried, we're letting you know we like them, had good results. Obviously did not lead to our miracle baby yet, but had other positive things about them.
Mm-hmm.
So, and with this one, we really could tell a difference. I mean, we both lost weight like so fast because it was all the bloat. And that was the biggest difference I noticed, was just and I don't even feel like we have a ton of processed foods, but obviously enough.
It adds up pretty quick.
This program, though, one of the things that I really appreciated, but it was so hard to do sometimes, is they encourage you to have 30 different like fruits and vegetables in a week. And maybe you're thinking that sounds easy, but when you look and count it out for all the different things that you like to eat, you're probably only getting like 10. And so, I mean, just changing up the different types of apples you like, different types of onions, different types of tomatoes, different types of carrots, different types of lettuce. So I really had to be creative when I went to the store, and I got like 3 or 4 different types of lettuce.
Yeah.
And you would try to incorporate that, into like meals for the week. So it was a little challenging, but also kind of eye-opening to realize that there's so many fruits and vegetables that we don't normally consume because we choose our favorites. So with all of this stuff we're talking about, remember, do it on your own time frame. For us, mostly me, and then he was a good person to kind of just follow suit. But it was over a couple of years, and it was mostly I was a little in denial at first.
Yeah.
I didn't think that I really needed to change too much. I was already pretty healthy and I made good choices. But then the more that time went on, I was like, well, what else can we do? And so we looked into a lot of things and we changed out a lot of stuff. And I feel like all of these have been to good, but I don't ever want you to feel overwhelmed that you're doing something wrong. Even with us I really enjoy my candles and stuff, but I've kind of weaned off of those just to see if it even makes a difference. I have noticed maybe I've gotten a little more sensitive to smell now because I don't have those smells around. So maybe that's a good indication. But don't feel like you have to completely throw away everything that you have. Just do gradual things. We have even done different things with hygienic products. So our makeup, deodorant, soaps, shampoos. I've swapped out our cleaning products. We still have some old cleaning products that we are kind of using up. We do still use bleach on an occasion. But like Branch Basics is awesome. I really have liked them so far. I'm still kind of learning about all the other clean, non-toxic brands. So you guys might be above me and more advanced than us there. But main thing is don't let it overwhelm you, but start making small changes where you feel comfortable. And really it's to your benefit, whether or not, we want to make sure that, we're doing all the things to get our baby, but also think of just general health, right?
Right.
Because I have noticed my period has gotten better. I mean, less, like I talked to you guys about before, less symptoms of me having, I used to spot on an occasion before my period, and I haven't done that since last October. So, but that was after the leap and the acupuncture and doing all these things. But I mean, still, even now, it's doing pretty good. So my symptoms are really minor. I mean, I still will have sore breasts sometimes after ovulation, but not always. Really minimal cramping, back pain, headaches, don't really have that. So I just want to kind of encourage you to look into that, just for, like I said, even if it doesn't lead right to your baby right off, it's definitely going to make you feel better. So
yeah. Yeah. And I mean, for me, I don't know. I think with the supplements, I can say, so I take a statin for my cholesterol, and I will say the CoQ10
big difference
helped with that. I was getting muscle pains and tightness and things like that. So that was a big help. I think the magnesium in line with that helped, but I think we mentioned way back, maybe episode 1 or early on when we were kind of summarizing everything of like, I took some supplements before we got married sporadically and different things like that. But since we got married, even at the beginning, started on like a men's 1 a day.
And just vitamin
kind
C.
of vitamin C,
Yeah.
kind of some
That
basic foundational supplements. And then of course like allergy stuff because I have allergies. But other than that, not really anything else. So of all the things we've tried, probably CoQ10, I guess fish oil has been a good add just for my blood work in general, different things like that. But I think that the CoQ10 and the magnesium fish oil has probably been maybe my top 3 that I've noticed like an actual measurable improvement.
Yeah.
The other things, like we've talked about, it might be in our heads, in our brain. Like, is it better? Is it not?
I think he liked the acupuncture. He just wasn't seeing the big results that I was seeing.
Yeah, I mean, acupuncture. It was a nice massage.
Yeah.
Right. It was relaxing.
Massage, really.
Well, like overall,
in a reference.
It was
okay.
I mean, I fell asleep during the thing. Right?
Yeah.
So
because they put a bunch of needles in you, and then you're under a warm red lamp.
Yeah, you get to just take a nice relaxing nap. But I was like, that's a really expensive, nice relaxing nap. So that was my point of view on it, like Naomi said. But
I still appreciated that he went with me.
Yeah.
That was another big thing, just the support too, that he was willing to try.
It's worth checking. So background as an engineer, it was data for me. Yeah. And it's like, I can't say no until I have some data. And it's like after a while, it's like I don't feel like anything's really changed that I could tell, so I stopped. Yeah. Right.
So he stopped in September, mostly due to a work trip. I continued on, I think, for one more electrical stimulation for around my ovulation in October of 22. But then they were going to be doing some price changes, and we were discussing just, if we wanted to continue on or whatever. So we did decide to stop. I did find since then, though, there is an acupuncturist. Our insurance will cover it if they're listed as an MD that does acupuncture, not just, unfortunately, just a licensed acupuncturist they won't cover. But if they're an MD that does acupuncture, can get it with our copay. I just don't know if it's so many sessions or whatever.
We haven't really looked into it much more than that.
I'd like to in the future, but we haven't at this point.
There yet.
So I think I'd mentioned this before in the previous ones. The only tea that I have tried, I do like the raspberry leaf tea and other ones that we've tried to during like my time of the month or whatever. But the Get Project Life tea has been the one tea that has been the most influential. It's expensive and it's disgusting, but it really has shown results. I started that end of April, and now I've gone through 3 cycles with it. I'm still probably not drinking it the way that it's intended. You're supposed to brew it, this whole bag, twice a day and drink it. And I probably do a half a bag, boil it in a lot of water. I still get really potent and dark, but I still do my 2 glasses a day, but it's not like the quantity.
You still use the whole bag in a day?
No, not
you
even.
do half and half? It lasts 2 days?
Yeah.
Okay.
So that's probably why. But I've noticed like increased VMs. I'm normally like a 1 day kind of gal, but it's gone like 1 to 2. I'm less bloated. There's more energy. My sleep has improved some. There's been some other factors that have helped my sleep, but I will not totally say that it's not helped my sleep because it probably has. I have had less breast tenderness during like my 2-week wait. Sometimes that's probably my symptom that probably sticks around the most. So that still comes and goes, but I feel like honestly, it's been less over the past few months. And I've definitely had increased cervical mucus. During the time that you're ovulating, you have like these certain amount of days that you have fertile cervical mucus to allow like fertility to happen. And I always thought I was pretty good in that area, but since being on this tea, I've noticed like an increase in quality and quantity and just duration. So that is a big improvement, whereas like I thought that I was already pretty good in that area, but it's even improved that. So They do recommend this tea normally 3 to 6 months for people that are 37 and under. Obviously, I'm 38, but they said they have seen good results in people that are older than 37. So I'm continuing to take it. Talked to about it with my recent NAPRO doctor about my increased cervical mucus days, and he was fine with it and said I could stay on it. So they do recommend you kind of assess your hormones before and after to see that it is helping. That's another thing to look at.
Yeah.
But mine were fine prior, and my recent blood draw still showed that they were fine in an optimal range. So I can't really say that that did a benefit because they were already good to start with.
Mm-hmm.
So kind of just a wrap up. I'll just talk about that all the things that you do when you're desperate enough.
Mm-hmm.
So I guess we'd always get that sense of hope, like we've talked about with each of these new things to try. But
yeah, I think, kind of like we've talked about before, where it's this fine balance, I think, of our main desire of trusting God in this and through this, but also not being passive and just sitting around and waiting.
yes.
Right? So it's this balance of, trying these things, looking up these things that have helped other people and trying them out and being willing to do that, but making sure that we don't maybe put those things on such a pedestal that we think it's going to be this magical solution and these kind of things. And it's tough. It's a fine balance, right? And I think to me it indicates maybe we've put, to myself included, right, put too much hope in these things when they end up not working and we're very disappointed, right? And that's kind of how I gauge how much I'm allowing my heart to be hopeful in these things when really I should be hopeful in God's provision for us and guiding
100%.
us to that, right? So
on the flip side though, like not hope in the things, hope in what God is leading us through.
That's right.
Right? So kind of in that sense of, I don't want to ever be thought of that I'm being lazy and not thinking and not doing something that God is going to use to lead me somewhere or help someone else or vice versa, So that's kind of, definitely I can get a little crazy, but
no, I wasn't even trying to, it's just in my mind, I try to check myself of like, how much am I really getting into this? And that's how I gauge. And then, if I'm thinking that I'm getting into it too much, then we have that conversation of where do we need to go and like, what does this mean?
Just
and these
communicate
kind of things.
about it.
But that's my personal checkpoint of how I try to.
It is definitely a thing, like you said, like check yourself on that it is God's timing and it's not our timing. And that's sometimes really difficult to process and deal with, but it is the truth. These things may help, but it's not the determinant that is going to lead to this like a pregnancy, right?
And it's always good to be healthier, right? So these things that we've noticed have guided us into a more healthy, especially at our age. We're not getting any younger.
Yep.
I know I'm not. You look like you are.
Thanks.
That was nice.
That was very nice. But I mean, in sharing our story like this, like we've said, even in our opening, we're here to let you know you're not alone. We want to use this story to glorify God and help everyone through the pain and the hurt and just the trial of the situation, and putting it out there and talking about it hopefully makes it easier for you to process and have conversations with your own loved ones. And once again, just know you're not alone. We see you. God sees you, So just kind of like an update. We'll close out this then. When this episode is going to air, it'll be this Saturday and we're filming it a couple of days ahead, but I am scheduled for surgery tomorrow. So this is something that is more of like an exploratory surgery. I'm having a hysteroscopy, and then a selective HSG along with a laparoscopic. So I've had the hysteroscopy before back in 21. Everything looked great. They didn't see anything. All the biopsies were good. Lining was fine. The selective HSG is something new for me. They're going to use a catheter to go up into my fallopian tubes and essentially fill them from the top down. So fill them up and watch them drain. I've had a simple HSG, and I was awake for that one, where they put the tubing in and they filled up your uterus first and watched it flow up to your tubes, looking for any obstruction. So this one's going to be an opposite. And then the laparoscopic is going to be where they go in through my abdominal cavity and look at everything fertility-wise from the outside, essentially kind of looking for endometriosis or if anything's kind of causing other problems with like how the ovaries are sitting in tubes and where my uterus is. So you guys can kind of be just praying for us with that. And we've been sharing, so you can find us on Hope Ahead Journey on Instagram. I've started sharing a little bit more of real time for the procedure, and we'll talk about it also later in an updated podcast too. So, but this is just kind of with the surgery, just a real quick thing. It's been hard for me in the sense of maybe a little anger and annoyance at the situation again, because I'm like, I really don't want to have to do this. You know, I would rather be able to avoid all of this and already be pregnant. But that's just not what our life is right now. So, I'm hopefully like, you know, God's using us and me to like kind of share with you guys and relate with you. And like, once again, bring awareness, right? Because the more awareness we can bring to this, maybe there'll be quicker solutions, and we don't have, like for us, I mean, we've had to wait like over 3 years for this type of procedure because we didn't know what we needed and people wouldn't do it
Didn't
or
direct us to it or
So we also have started even doing the Creighton method. That's what the NAPRO doctor had recommended us get with a fertility specialist that can teach you all about, like, and that's just observing like cervical mucus, and they use it for avoidance and for pregnancy. So that's been also a little frustrating because it's another new thing I have to do, and you have to chart it a weird way, and they have like all these codes you have to do. If you've done it before, you're way more of an expert than I am, or we are. Eventually, I am going to give more control over to him because they recommend that. But right now, I'm in my control mode, but I have to learn
and
it.
You're learning.
I do have to learn it and know what I'm doing and even like observing. So just, you know, we wish this wasn't our path, but we talked earlier this week about how Satan can just attack us and make us feel alone and make us feel like invalid, you know, I mean, that we are isolated and that we're not handling the situation well, that other people handle it just fine. And, you know, how dare we even get frustrated about it and belittling us. So we need to make sure we put that to death. We die to self. And in order that we can rejuvenate and heal, not only for ourselves, but also for others. In going through this, I really hope that I'm helping someone else, you know, and talking about it and sharing. Just like I said, just so you know, you're not alone. And through our worst suffering, sometimes God is the most glorified. I don't always know why that is, like, but it's right. I mean, when things are happy, we're not glorifying God as much, but when things are bad, we're really seeking Him a lot more. And so it's been a thing where we've been drawing closer to God. So we're sharing this pain with you guys because, like I said before, you know, we see you in this pain. God sees you in this pain, and we're walking alongside you in this. And I'm sure you're walking alongside with us as you're listening and joining in. So community. So important, right?
Yeah. And to add to that, you know, like you said, we're still learning.
Yeah.
And I think one example we're trying to show is to set the example of like, you don't have to be perfect at this.
Yeah. Because we're definitely not.
I mean, we're not, you know, we're not perfect. And I think, you know, I think trying to set that example of trust in God as you work through it, as you learn. Don't wait until you're perfect at it or you consider yourself perfect at it before you really get into it and try.
Yeah.
Right. Yep. And that includes trusting God. Yep. Right. I think a lot of people think they have to be perfect before
and you
God
don't have
will
to be
accept
perfect
them.
to pray.
And it's like, absolutely not.
Yep.
So.
Yep. Come as you are.
Yeah.
Right?
Yeah.
So our scripture for this week, we have a couple. Do you want to go ahead and read them for us?
Sure. Yeah. So the first one is John 17:10. It says, "All I have is yours, and all you have is mine, and glory has come to me through them." And then John 14:27, "Peace I leave to you, my peace I give to you. I do not give to you as the world gives. Don't let your heart be troubled or fearful."
Yeah. And in reference with the John 17:10, all I have is yours and all you have is mine. So yes, that can be possessions, physical things that we have, money, whatever, but that is also our pain and our suffering.
Yeah.
God has that. So you're not alone in that. He weeps alongside you and feels your grief.
Yeah.
And he's there. So all you have to do, you just really need to just seek him out and let him know how you're feeling, because he wants to share in that grief with you, so, but we'll go ahead and close out in prayer, and thank you guys for listening and tuning in.
Yeah. Dear God, thank you for today, and thank you for just another opportunity to share how you're working in our lives, and just try to describe the struggle of just what we're going through, the emotions that it causes, and the stresses that it causes, and we just pray that that our actions justly and adequately show our trust in you, and we just give you all the glory that will come through this. We pray for the people watching and listening that are going through the same thing, and just the struggles that they're going through that are their own, that also we haven't had to go through. You do know their struggles and their pain, and we just pray that you would give them a calm and a peace that only you can provide. And we pray all these things in your name. Amen.
Amen. All right, guys. Hope you have a good day. So if you're watching us on YouTube, great. You can also find us on Apple, Spotify, and Pandora. Or if you're listening to us on any of those audio, you can find us on YouTube. Or like I said, Hope Ahead Journey on Instagram for more live updates.
Yeah.
Thank you.
Thanks,
bye,
guys.